I'm going to talk about the importance of patient safety and safe surgery. I will discuss this topic in both the hospital setting and in dentistry and its practice. Starting with the hospital setting, the patient safety is essential in any hospital surgical environment. Adverse events during surgical procedures can have devastating consequences ranging from complications to a patient death. Let's talk about the key elements of safe hospital surgery. Let's start with the surgical checklist. This checklist is dictated by the World Health Organization. It's implemented globally. It reduces surgical mortality by up to 47%. It includes verifications of the correct patient, the correct site, the correct procedure, an informed consent, and availability of necessary equipment. Next, we have the correct patient identification, which uses at least two identifiers, the full name and the date of birth of the patient. It must be said before any procedure. Next, we have the marking of the surgical site. Next, we have infection control, which are strict protocols for asepsis, antisepsis, antibiotic prophylaxis, and instrument sterilization. Then we have the counting of gauze and instruments. This prevents the rotations of foreign objects in surgical cavities, a serious but preventable complication. Lastly, we have effective team communication. Teamwork and clear communication between surgeons, anesthesiologists, and nurses significantly reduces errors. Next, we are going to talk about dentistry and the practice of it. While in dentistry and in dental offices, although dental procedures are often perceived as less risky, patient safety is equally critical. Dental offices perform invasive procedures that carry a specific risk. Let's talk about the fundamental aspects of it in dentistry. Let's start with infection control and biosafety. The oral cavity is home to millions of microorganisms. The use of protective barriers, proper sterilization of instruments, and correct handling of biological waste are essential. Next, we have the medical emergency management. Offices must be equipped to handle emergencies such as vasovagal syncope, allergic reactions, hypertensive crisis, or hypoglycemia. Staff must be trained in basic CPR. Next, we have the complete medical history, identifying pre-existing medical conditions such as diabetes, hypertension, coagulation disorders, or allergies. This is crucial before any procedure. Next, we have safe management of local anesthetics. It's important to calculate the correct doses based on the patient's weight, to know the contraindications of it, and recognize signs of toxicity. Next, we have the prevention of aspiration or ingestion of objects. This includes the use of rubber dams, protective gauze, and constant supervision during procedures with small instruments. Next, we have the safe radiology. This means to use the adequate radiation protections with lead aprons and techniques that minimize exposure. Lastly, we have safe oral surgery for extraction and minor surgeries to verify the correct tooth, plan the procedure, have protocols for bleeding, and consider the need of antibiotic prophylaxis in at-risk patients. With all of this being said, let's talk now about the universal principles in both hospital and dental offices. We have first the safety culture, which is fostering an environment where errors are reported without fear of reprisal, allows of learning from them and preventing recurrence. Next, we have continuing education. Staff must stay up to date in safety protocols and best practices. As we said before, we also have the informed consent. We also have the proper documentation needed, which has to be complete and clear. And lastly, we have an emergency protocol. Patient safety is not a luxury, it is a fundamental right. Implementing these protocols saves lives, reduces complications, lowers costs associated with adverse events, and strengthens confidence in the healthcare system. Every healthcare professional, regardless of their specialty or work environment, has an ethical responsibility to prioritize safety in every action they take.